psychological, physiological, and physical. Okay? And with the psychological, the physical becomes incredible. And the confidence that I see in the patients is impressive. Alzheimer's disease. This became a pet project because my mom was diagnosed 6 years ago with it. You saw her report earlier. And after I got finished doing that 3 months of treatment on her, 6 months between visits, but 3 months of actual treatment, one of my siblings threatened to send me to the medical board for practicing illegal medicine. So I had to curtail it, and you watched her crash. And my other sibling, there are 5 of us, my other sibling, female, said, well, you shouldn't be doing this because we don't want our mother to be a guinea pig. So my response was, okay, so let's do nothing and watch her decay when there's such an incredible mass of information showing the benefits. And this is what led me to this 3,500 compilation, 3,500 articles compilation, and talking with some of the best people that are supposedly in the United States about Alzheimer's disease. Okay? So the epidemiology of it, most common cause of dementia, as you know, 4.5 million people within the United States, and it's expected to jump to 14 million by the year 2050. And it's about $1 billion a year industry. That's the reason why, we don't want to fix it. Generates too much money. Mementa doesn't do anything. Aricept doesn't do anything. And each year, Alzheimer's disease develops in almost 1 in every 10 individuals over 85. Mom's 86. And a meta-analysis showed that the age-specific incidence of dementia is exponential through 90, and then it seems to level off. The average incident rate of Alzheimer's is between 70 and 74. Mom started with it at 80, 79, 80. And that's the incident, and it's increasing to 3.9 from 0.51% to 3.9 by 85 to 90. So it's what, a 700 time increase. Increased mortality rates makes Alzheimer's disease the 4th leading cause of death in patients older than 65, and the mean survival is 8.1 years from the onset. What does that mean, onset? And the cause of death is usually an infection, pulmonary functions go down, and data suggests that the cause of death may be cardiovascular, but it's pulmonary. Femininity is a risk factor for it, maybe because they lose the protective hormones, testosterone and what have you. And it's always been looked at as being a dominant inheritable issue with the, APOE, XYZ. And if you actually look at the statistics, 55% of the cases have no genetic predisposition. 55% have no predisposition based on genetics, even though it's being told to us it's a genetic disease. So that we don't look at the real causes like statin drugs increasing its occurrence, or the little blue packets with aspartame in it, or the environmental toxins that we're going through, or the PVCs, the ABCs, and all the letters and salads of letters that we have. It's environmental toxins that occur. Hormone deficiency helps. And these are just the 8 stages of Alzheimer's. And the pathophysiology, there are a lot of players in it. And what I'm going to show you is with every player, there's a barrier set up by having adequate physiological levels of hormones. As I said earlier in the menopause section, the use of progestins, Provera, 17-hydroxy or medroxyprogesterones, increase the occurrence of Alzheimer's because anything that increases inflammation increases IL-1 beta, also tumor necrosis factor. And I think the real reason why the COX-2s were taken off the market is because they were phenomenal at dropping the levels of Cal spaces and also improving upon the level of interleukin-1 beta, 1,6, as well as knocking down tumor necrosis factor. You're shaking your head, yes, you've read the articles. Impressive. And then now we have what, coumarin? No, not coumarin, spice. Yeah. Anyway, neurology is simple. It just looks messy. So APOE. It's a membrane protein involved in cholesterol transport. That's why you're seeing the issues about, cholesterol up and Alzheimer's. They're trying to relate the two together. And it might be because, they're trying to sell more statin drugs. But there's no atherosclerosis or atheromas are not based upon cholesterol. They're based upon the inflammation that occurs. As an innocent bystander, cholesterol gets dragged in. If you don't have the inflammation, it doesn't get dragged in. Don't do the crime if you don't want to do the time, right? In the research on apolipoprotein E, or epsilon 4, 13 years, this project called the Mirage has looked at genetic factors and so forth. But in the majority of cases, no family history of AD, the epidemiology or actuary lifetime risk of AD is only 15%, lifetime risk is 29%, lifetime risk of a patient with no APO is 9%. The question of screening as isolated population is still very questionable. Again, 55% of the cases have no explanation in genetics for why it's happening. Mutation is thought. But the key in perception for Alzheimer's is this protein called amyloid protein precursor. Beta amyloid comes from a glycoprotein. Beta amyloid is a 43 amino acid sequence, but it's this big guy, this APP, that gives rise when it's cleaved to the beta amyloid. And how it occurs is the APP goes to the cell membrane, and because of a secretase enzyme, it cleaves it. And it cleaves it inside the cell at the 43, leaving on the outside a beta amyloid segment that accumulates over time, and that's how you get your plaque. And what happens with the plaque is that it then gets the interleukin and the tumor necrosis factor that leads to the inflammation, and the small blood vessels constrict and coagulate, and you get microstrokes. And it's the accumulation in the frontal region that leads to the frontal dementia, where people can't remember things. And how do we stop that beta amyloid?